Hello everyone, welcome to our Mother's Health podcast. I'm recording this episode from the beautiful and gorgeous Mediterranean island of Malta. To be precise, I'm in Goza and I've been amazed by this stunning coastline. As you can see, very beautiful, gorgeous environment, rich history and amazing people. The hospitality has been amazing and everything. Just like every tourist, you'll be amazed by the lovely coastline and the environment. So I'm really delighted to be here. But as a maternal health advocate, I began to dig into the maternal health care system in Malta and just to understand the maternal health indicators of the people of Malta. And so why is Malta unique? Malta is unique because there are a lot of very good indicators here in Malta. One, the maternal mortality ratio is 8 out of 100,000 live births. And as you know, the national average is about 197 per every 100,000 live births. And when you look at Africa and other sub-Saharan African countries, it's up to by 1,000 per every 100,000 live births. So this is just 8 out of 100,000. This shows that Malta has a very strong maternal health indicator. And Malta is one of the smallest countries or islands in Europe. So this is an amazing statistic, and we've continuously had good maternal outcomes. So we're going to discuss why Malta stands out in Europe. So we're going to talk a little bit more about this. We're going to be looking at what makes Malta healthcare system and also their maternal health indicator very good. We're going to dive into their system to see what's going on and how they've been able to achieve this. This episode is not to compare country by country, but rather it's how we can learn from positive practices, from positive healthcare system, and how we can adopt, because I believe that if we can learn from each other, then we can have better maternal health outcome and we can improve maternal health globally. This will shock you. In 2023, only one person died in Malta, and in 2024 only 2 people died in Malta. That's significant result. This kind of result we like to see in sub-Saharan Africa. So I was torn by these statistics, and this is impressive. From the national data, there were only 34% of cesarean section and 66% of women had vaginal birth delivery, which is also very significant because it shows a good healthcare system where women are supported to have their children naturally. In the last episode, talked about push to push. I'll put a link in the description box so you can watch that video. But we talked about how women are often pressurized to do a cesarean section, but this is not the case for Malta because a high percentage of women are having their babies naturally and supported by the system. So the system has been fantastic. There's been consistent positive outcome for women here in Malta. As you can see, beautiful Malta. I love it here. It's gorgeous. Coastline, beautiful city. I'm very delighted to be here. Just going to do a 360 of this view. I've been touring Valletta. I've got to Goza. I've gone to several places, St. Paul Bay, and a beautiful place. But let's go back to maternal health because that's the subject for today. Let's take a pause on the beauty of this place. So what can we learn from the maternal healthcare system in Malta? There are a few things we can learn from the Malta healthcare system. 100% skilled birth attendants in Malta. This shows that every woman in Malta is accessing healthcare for childbirth and delivery, postnatal, prenatal. It shows very high, 100%. That's excellent. So it tells me that they are not very influenced by religion. I could see that Malta is also very religious country. I can see a lot of cathedrals and very significant cathedrals. I'm going to put the post here in the podcast. But it tells me that despite their culture and religion, this has not deterred them from using the healthcare system because it shows, their statistics shows that almost 100% skilled birth attendants. Also, one thing I must stress about Malta is that they have universal healthcare for all women. Women have access to healthcare, and this breaks all the barriers with accessibility. Women can access healthcare the way they want it, and that's very good. It helps with continuity of care, and it has to help to support people that are not financially buoyant to access healthcare. There's a good system of communication, of listening, continuity of care, which makes it very significant. So very impressive system. This tells me that healthcare is not just about technology or building hospitals. It's about timely access. It's about compassionate care. It's about encouraging women to use their service and creating an environment where women can feel respected to use their service. Because if the statistics shows that 100% of women are accessing skilled births, that tells me that you're creating a good environment for women to use their health system. And I'm not surprised why the health indicators are good. Like I said before, we can learn from some of the good practices in Malta, and that can help us to also reduce the maternal mortality across the globe. So very fantastic statistic there. Looking beyond the stat, I know it's been great. I've said a lot of things about Malta. I've said all the fantastic things about their system and the health indicators and all of those beautiful things I've said. But we're going to look beyond that statistic, because if even though one woman dies, it's enough for us to discuss why they died and what we can do. So we're going to look beyond that statistics, and we're also going to discuss and also share how we can overcome maternal mortality or reduce this rate. So there has to be continuous support for women, mental health support with breastfeeding, support to access healthcare financially, postpartum support, prenatal support is very, very important in maternal care. So this is what we must continue to do to improve maternal health indicators, regardless of the death rate, whether they are low or high. It's good for them to be low, but even when they are low, it shows that a life was lost, and we must take that seriously, and we must look into the consequences of that and some of the contributors or contributing factors to why those people lost their lives, and we must continue to do research to improve the maternal health indicator. As you can see, all beautiful here in Malta, and yeah, there's still more room for improvement. There's still room for education, training women. There's still room to even bring down the maternal death rate to as low as 1 per 100,000 lives. But that would be the dream for Malta, and that will improve the health conditions of women even further, despite the low death rate here. In conclusion, as I sadly leave Malta this week, I'm reflecting on the system. I'm not just going with all the beautiful experience of the beautiful coastline, the historic culture and history of Malta, very rich history of Malta, but I'm also reflecting on their healthcare system and what they can teach the world. It shows that compassionate care works. Accessibility to care can reduce maternal death. It also shows that respectful care is also important, and evidence-based practice very, very important. It also reflecting also it also shows me that we must not let religion or our tradition deter us from using healthcare. Rather, we must seek healthcare at the appropriate time, because timely healthcare can save life. But I also like us to remember what it takes to have a positive and a good healthcare. I want us to remember that respectful care matters, compassionate care matters, accessibility to care is very important. So governments around the world must make healthcare accessible. I want us to also remember that universal healthcare can help reduce maternal mortality. So these are some of the lessons we can learn. Not every country has all the answers, but we can learn from each other. And that's the important thing, learning from each country, learning from ourselves, sharing practice. Some people said Malta is one of the smallest islands in Europe, so of course. But that said, I think the statistic compared to other small islands is really good and very significant indicator that shows something right is happening in Malta, and they're doing something right for them to have 100% maternal access or a skilled birth attendant. That's really significant. So it shows they are moving the right step in the right direction, and we must learn from their healthcare system. We must learn from why their healthcare system has been positive for all this, consistently positive indicators for over decades. I think these are the things we must learn. We must remember that maternal life matters. Safe motherhood matters. Therefore, we must stay informed and educate ourselves. Share this knowledge with your friend. If you enjoyed watching this podcast, subscribe to our Mother's Health podcast. And until next time, stay informed. Bye-bye. For safer birth, our